Hey there, it's Heidi here from the First Aid Nest. Today's video is what are the benefits of using a doctor's ABCD action plan. So doctor's ABCD is an acronym that we use in first aid scenarios and emergency scenarios just to keep us all right. And it's actually something even that we use really in the hospital, less a few of the, the first one, danger, because hopefully a hospital environment, we've already got that covered. So we'll go through what doctor's ABCD is. So it's DRSABCD, which is D for danger, R for response, S for send for help, A for airway, B for breathing, C for CPR or circulation, it used to be, and D for defibrillation. Okay, so we'll go through those points now. And it's really good to remember this this algorithm or this this acronym, because otherwise a first aid scene, an emergency with someone unconscious or something's just happened, can just be a big jumble in your head. So it's like, right, start at the beginning. D, danger is what D, the D part of the doctor's ABCD. What we need to be looking for is if you see someone, say your loved one in the corner of the house, suddenly just laying on the floor, you've got no idea what's happened. Maybe it's your child, maybe it's your husband, wife, whoever, or you drive down a road and there's someone just laying in the middle of the road. First of all, you've got to take a second to scan the area and see, why has this happened? If I run in, is there something there that's also going to put my life at risk? And then you're no use to help them anyway. So is it a slippery floor and they've banged their head? Have they vomited all over the place and slipped in it? Are they holding on to an electric cord? Have they been electrocuted? If you touch them, you'll be electrocuted too. Are they in a line of oncoming traffic? Is there a piece of furniture leaning and, or, crushing them? Or is there a piece of furniture that is going to fall on you? You've got to take a second to scan the situation instead of just running in, because you may be better than throwing yourself in that situation than just call the emergency services so they can come and help, and and just be wise in that scenario. I know sometimes if it's a loved one, you want to just rush in, but really you just got to think twice. It's like jumping into a moving river of rapids to save someone when you just can't swim, and you're not going to be able to help them even though your gut instinct tells you want to jump in. Okay, so that's danger. So once you've assessed that, you want to see if there's a response, because they may have just slipped over and they're just kind of laying there a little bit dazed, and you can help them, sit up or assess if what's gone on. So the next one is response. So what you're going to do is you're going to approach them if it's safe to do so. You're going to hold them by the shoulders, and you're just going to give them just a little shake, not a big one, just because they might have some injuries, just a little shake, and call their name. So you say, hello, hello, can you hear me? If you know their name, you can call their name. Now, if they respond to you, if they open their eyes, they're wide awake, and they try and sit up, if they seem as if they're able to, that's great. If they just open their eyes, but they're not really moving, then at least that's a response. So you know they're okay. But if they don't respond at all, or they have responded, but they're still not moving, we need to send for help. Okay. So that's the next scenario, is S for send for help. So we need to either call the ambulance ourselves if we're the only ones on the scene, or we pinpoint someone if there's someone else there and say, you in the pink top, please call an ambulance. Because if there's a crowd, especially, everyone thinks someone else has called an ambulance, and sometimes no one has. Okay. So make sure we then send for help. We call emergency services. It may not just be an ambulance. We may need the fire engines. We may need the police. Okay. So S is send for help. So that's DRS. That's our doctors. Then we're going to start assessing the casualty with the airway, with the A. Okay. So airway, we're going to simply just lift the chin a little in an adult. With an infant, we're going to have the chin in what we call a neutral position, like this. But with any child above 1 and up, an adult, we're going to lift the airway a bit so that we can get a better view. With an infant under 1, we want just a neutral position. We want to open the mouth and simply see if there's anything in there. Is there anything blocking the airway? Now, the guidelines now tell us that if we can see something and it's really obvious and it's very clear and we can actually get it with our pincher fingers, we can reach in and try and pull it out if it's obvious. We do not do any mouth sweeping, sweep to the back of the throat. We just can pull something out if we can see it, okay? If there's fluid or vomit in the mouth, we want to turn the patient onto their side into the recovery position and just slightly help them drain this fluid out, not by finger sweeping in, but just inside the lips, just inside the front teeth. If we want to, we can help get that fluid out, okay? Once we turn them back on their back, if it doesn't look like there's anything in there or we can't see anything at all, then that's our assessment with the airway, okay? If there is something right at the back of the throat that we can't get, we mustn't try and finger sweep, okay? So once we've checked the airway, we need to check for breathing, all right? So what we're going to do is the look, listen and feel. So what we do is we put our ear right down to just above the patient's mouth, okay? So we're looking down towards their toes. And what we're looking for is we're looking in that position for chest rise. We're listening for any breath sounds. And we're feeling for any breath on our cheek because the cheek's very sensitive. Okay, so that's our look, listen, feel. And we're going to do that for 10 seconds. Now, if they're breathing, that's fantastic. We're going to pop them in the recovery position if it's safe to do so. If they haven't got any obvious breaks down one side or it would be too uncomfortable too, we can pop them in the recovery position and await help and continue to monitor their breathing. If they're not breathing, we're going to go straight into CPR. We no longer check for pulse. It doesn't matter what age the person is, whether it's a baby or an elderly person. We're going to go straight into CPR, okay? Now, CPR, we've got many blog posts on how to do CPR, but we're going to do 30 compressions to 2 rescue breaths. If you haven't had first aid training, contact us. But if you haven't had first aid training, then the guidelines say that if you don't have to do the 2 rescue breaths. If maybe you come across someone in the street that's vomiting all over themselves, you don't really want to, that's fine. Just know that continuous compressions is really great. It's like 80% of a resuscitation, all right? Because a lot of the time the blood in the body is still very oxygenated, and the compressions you do on the chest are the most important part, okay? So we would do 30 compressions to 2 breaths if you're doing the breaths. The compressions around 2 per second. So that's the rate, and you want to get about 1/3 of the depth of the chest, okay? So we want to do 30 compressions to 2 breaths, continuous, until either help arrives, the person recovers, or you become physically exhausted. They're the 3 reasons to stop CPR, okay? If you're in a public place where there's a defibrillator, then we need to get the defibrillator and place it on the patient. Now, defibrillators, it might seem like they'd be really complicated. They're actually very simple to use. Again, we teach people how to use them in our classes, but they're very simple. You would just open the defibrillator. There's pads, 2 pads in the defibrillators, and it will tell you there'll be child pads and adult pads, and it will tell you on the pad exactly where to put them on the body, okay? Then you simply press the big button, it's usually green or red, on the defibrillator, and it will speak to you, and it will literally tell you, I'm monitoring the heart rate, and whether you need to shock or just leave alone, okay? So it will tell you to continue compressions or stand back because we need to shock, and it will tell you when to press the button. So it actually speaks to you and tells you what to do. So this is doctors ABCD, danger, response, send for help, airway, breathing, CPR, circulation, and defibrillation, okay? Doctors ABCD. I hope that's helpful for you today. You know where we are if you have any questions, or if you want to book in a group with us or come to one of our public classes in Sydney. Okay, take care.